The Charlotte Ledger Podcast is a member of the Queen City Podcast Network.
Hey, it's Tony Mecia with the Charlotte Ledger, and you're listening to the Charlotte Ledger Podcast. You can find out more about the Charlotte Ledger at thecharlotteledger.com. Today, I'm talking with Dr. Dale Owen, the CEO of Tryon Medical Partners, who's also a practicing cardiologist. Tryon Medical was formed in 2018, when about 90 doctors with Mecklenburg Medical Group left parent company Atrium Health to form their own independent practice. I think it's fair to say that there were some sharp words at the time. There was a lawsuit related to the ability of those doctors to leave Atrium. In the suit, the doctors characterized large health systems as monopolistic and run by a, quote, bloated management bureaucracy. Now, Tryon Medical has been in the news a little bit lately. I'd like to get into that. But I'm also interested in what that experience has been like in building a medical practice essentially from scratch and where it's going. Tryon's been at this now for 6 years. And Dr. Owen, I'm guessing you learned a lot in that period. I'd like to unpack that a little bit. And, you know, healthcare is something that we all depend on. And so understanding how and why it works the way it does or doesn't work the way it does is worth discussing, I think. And so, Dr. Owen, thank you for joining me.
Happy to be here. Thank you for asking me.
All right. So we'll get into some of the specifics in a minute, but I wanted to start with a broad general question. I think generally people tend to like their doctors. Some of the advances in medicine are absolutely amazing if you think of where we are now versus just a few years ago. But I think people perceive, if you look at polling, they perceive that the logistics of delivering that medicine are kind of tricky. You know, people complain that it's hard to get appointments. It's expensive. Why is that? Why is it so complicated? And why do people want to pull their hair out when it comes to the delivery of medicine?
Well, I kind of go back to when I started practicing back in the early 90s. Yeah. And we can start by remembering that I was filling out patient notes by writing script by hand. And we thought that was onerous at the time. And then we had all of these great innovations and technologies and the ability to dictate, reel-to-reel type of cassettes. And then we went on to voice recognition and so forth. And we thought that was really going to simplify medicine. Well, let me tell you, it's only gotten more complicated. My day is busier than it ever was when I was handwriting my notes, if you can believe that. I think that what really comes down to is that with more innovation has come more delivery of data. Data has become the king. Data on aggregation of patients, not on the individual patient, but on aggregation of patients, insurance companies then getting involved, pharmacy companies getting involved. There's not a day that doesn't go by that I don't have 10 things to fill out from either an insurance company or a pharmacy company. I've got to fill it out by hand, go back into the chart, all these various things. It's taking more time. It's more effort based for the physicians. And I think this is trickling down at all aspects. I mean, we have to remember that this is, the healthcare system is the most expensive in the entire world per capita by a factor of 2x. And the outcomes aren't nearly as good. And we're in the top 30 finally, thank goodness. But there's a lot of things that are going into this. We have lots of lobbyists. We have lots of lobbyists from health insurance companies, also from, as I mentioned, the payers, also from the other organizations throughout, the country. The insurance payers and other lobbyist firms, pharmaceutical lobbies and such are playing a big role in healthcare. And it's not prioritizing the patient first, it's prioritizing the business and financial aspects of medicine more than ever.
Well, I know it's a big topic. We could probably just talk all day on that. I'm sure whole books have been written on it. But, I wanted to talk a little bit about Tryon Medical and where you all fit into that. And you founded Tryon Medical in 2018. The goal was to make it a sort of a more patient-centered medical experience, fighting back maybe a little bit against some of those things that you just mentioned, but, and to do it without the bureaucracy, without the high cost. Have you succeeded in that?
Well, thanks for asking that, Tony, because I think the main reason that we decided to leave the hospital system was because we wanted to have more control over being able to see the patient, taking care of them the way we thought that they needed to be cared for. And we felt like it needed to be a better patient-centered, patient-first methodology. We wanted to be able to coordinate the care better. We knew that if we did that, we could also drive down the cost at the same time. And we already knew we had the most experienced, highest level physicians. So the main thing was coordinate the care, put the patients first, and the physicians then had to, organize themselves, which is what we did. And we took the risk on behalf of the system and the patients to do the right thing in medicine. So I hope that answers some of your question.
I mean, but is it possible to build a business on that? Has that worked out the way you hoped?
It has. I'll tell you, the very first day, patients literally stood up and cheered and clapped when we walked in the very first day. They knew that we were taking the professional risk in building a practice, literally, as you mentioned, out of thin air. We call it out of air. We didn't have staff. We didn't have buildings. We didn't have contracts with insurers. We had literally nothing. And we had to build it from scratch. And that worked. And I think patients realized what effort we put into it and how we put them first. And we were betting on the patient-physician relationship being the strongest. I think we were completely correct. We now are serving almost 200,000 patients in the Charlotte-Mecklenburg area, which blows my mind as to how important that's been. So the patients understood what we did, and they supported us. Now, in forming the business, though, we had to have experienced business people involved. And we had some that volunteered and came out of retirement and things of this nature that were critically important in the process. And I can't thank them enough. And then we had the ability to get real estate appropriately. And I think that the most important thing was initially in a fee-for-service basis. Mecklenburg County is very strong in fee-for-service payer basis because of the two hospitals. And we probably could not have launched ourselves without that fundamental foundation. But now things are moving, as we had hoped, much more into what we wanted, which was value-based care, or value-based medicine is what it's called. And I think that that's where the coordination of care comes into effect. And we're doing I think a phenomenal job at that, and are driving our quality metrics and patient satisfaction scores and so forth. And I mean, literally to the point that we have won for 2 consecutive years RC Patient Satisfaction Award for a medical group in the whole country.
All right. So, you've been at this now for 6 years. So what does 2024 Dale Owen know that he wishes he could have told 2018 Dale Owen?
This is hard. I'm sure that Atrium and the other players knew how hard it was. We just knew we needed to do what we felt like was a better job taking care of patients and for the right reasons. But we've learned a tremendous amount. And I mean, I just have to say kudos to our physicians for putting it all on the line financially, professionally. And, this has never been done in the entire country. We're the only ones to ever do it. And I keep saying that, and no one's ever challenged it yet. So I still believe it, and I've researched it, and I can't find anybody that's done it. And there's a reason for that. It's really hard. We were a really super solid organization, had great leadership, and I think that that's what really helped to stimulate us to have the guts to do it. Other lessons, one of the things that I really like seeing is how value-based care is coming into fruition now, because it's not about volume anymore. Seeing volume of patients, how many you have to see a day, how quickly, things like that. It's about taking care of holistically of the whole patient all the time.
Value-based care. Can you just explain what it is and how it differs from fee-based?
Well, so fee-based or fee-for-service care is you see a patient for a period of time, and as a result, you get paid X for it based on the code that you put in and so forth like that. But value-based care is how can you serve the patient, maintain or improve quality, decrease the cost of care by coordinating the care with all the other physicians, healthcare providers, say chiropractors, labs, X-ray and radiology, colonoscopy, site of service things, all these various things where the primary care physician can become the quarterback of the process and coordinate things rather than having to see somebody with 5 different problems in a 15-minute office visit. You get one of them taken care of. You've got to refer out 4 of them, and they're all doing their own thing, and it's not coordinating the care, and it leads to much higher costs and patient dissatisfaction.
Gotcha. Okay. And I know, now getting back to this idea of how you've been the only ones to do this. I know I think I talked to you in 2019, I think a year after you started it. And part of the idea was, well, we're going to show by being successful that, we can get other doctors, to form their independent practices. And I think at the time you had people come with you and say, how are you doing this? How did it work out? Looking back on that now, are there others that have gone down the same path or tried to go down the same path? Or have you sparked sort of that revolution, I think, that you were hoping for?
Well, I would say that we sparked it. I don't think there's any question about it, but it kind of got snuffed out initially by COVID. COVID, really put everybody back on their heels. And you'll see that if you look at all the data, about a third of independent practices succumbed to that and are no longer either in existence or they sold because of financial pressures and things of that nature. Coming out of COVID now, everybody is much more energized again in value-based care. And the reason I mentioned that as part of the answer to your question is that because fee-for-service rates are going down and CMS and the insurers are pushing us into value-based medicine by 2030, we're becoming much more reliant on those aspects of healthcare, which also means that because we have succeeded in doing it so well, others are now very interested in our platform. So that has sparked that type of revolution that I was hoping for. And we're now able to take out to the communities and to different organizations throughout Mecklenburg, contiguous counties, all throughout the state, out of state, regions. We are literally talking to, many organizations at this time in regards to that. We'd love to partner with everyone in primary care to keep driving this engine on behalf of the patients.
You mentioned COVID. That was obviously a huge challenge to our entire healthcare system, society, a lot of different things. But if a lot of as you say, a lot of independent practices were snuffed out or encountered big problems with that, how did you all manage to persevere through that? What was that like?
Well, we got really creative. One of the things I did was, I had some background in infectious disease in the past and actually was going to do that until the AIDS epidemic hit and sort of crushed the ID profession at that time. But I had read tons on the 1918 pandemic, influenza pandemic. And when I first heard of this thing with COVID, the very first thing I thought of is that this is going to be a pandemic. We have to get ready very, very quickly. And so meeting with our board of directors, we did a complete pivot on virtual care. We only had 2 physicians doing virtual care at the time. And in 2 weeks, we had 100% participation of all of our physicians being taught all the properties of virtual care and how to do it and so forth. So we had to move really fast. We were also very concerned that a lot of patients wouldn't come into the office because they'd be fearful that people who were sick would be there. So we got messaging out to our patients immediately that none of the sick people were going to be allowed in the office, that our offices were going to be pristine and be allowed to accept anybody. And as a result, we saw about 90% of our patients in the offices. And we created these satellite centers where we had gown, glove, mask, almost in hazmat suit situations where we would take care of people who were ill coming in their cars and so forth. So we had 3 or 4 satellite clinics doing that. And we had 1-day turnaround time in swabs and testing for COVID. As you remember, when the big mass of that became problematic, most of the swabs were coming out of Italy and China, and they got embargoed, in the ports. And so, what might have been a test one day didn't get, verified or anything for, 10 days. What we had was, we had found a group that in Maine that was making in the U.S. the swabs for these tests. And we found a lab that would process it. They just got certified. And for that reason, we were able to turn things around. And we had tons of major corporations coming to us to make sure that we could test them. Like a lot of the nuclear power industry came to us as well for that very reason.
I wanted to ask you just getting back to this idea of growing a business, typically, you look at other businesses and it's sort of fun when you start out and you're kind of an insurgent. But then over time, as you get more established, people view you as more established, and maybe their expectations are higher than they were when you're first starting out. And it strikes me that now you're sort of in this phase potentially where you're in a different mode from being the little upstart guy to the more established guy. What's that been like, just running a business, moving it from that really early stage to now this more established stage?
Well, I think that, it's seen in different aspects of the whole process. The physicians expect more out of the business aspect that supports them. The patients expect more from the physicians. The expectations are just generally higher. As instead of the little startup and engine that could, we now are the significant engine that can. And now patients and physicians alike are looking for those opportunities for efficient. What's the bane of every medical practice's existence is always the phone system. That's always number one on the list, and we've challenged ourselves with that 3 or 4 different ways, and it always improves. But we still want it to always be better than it is, and I think it's our own desire to make sure that we're providing top level care. We've been in top doctors and so forth. We have to make sure we're maintaining that status in top doctors. And we have been. We've actually increased that. I mean, we had 40 plus of the top 160 physicians in primary care across the state, all in one practice. So, that's all those things become important. The expectations increase significantly, I would say.
Okay. And sort of the corollary to that is, like I say, you've been at this for 6 years or so. And, I know initially you were fairly critical of large hospital systems. Is there anything that you now look at and say, okay, well, I understand that a little bit better. I understand why things are the way they are. Have you softened a little bit on that now that I'm guessing, and you alluded to this earlier, where the hospital systems are probably saying, this guy has no idea how hard this really is. Is there anything that you're now looking at and saying, okay, yeah, this is really hard, and I understand why things are the way they are?
Well, I really appreciate the question, and I have thought long and hard about those types of things. I would say that the major principle is still not being addressed by hospitals across the country, and that's providing the quality and driving down the cost. It's still not being addressed. We're still, as I mentioned, barely in the top 30 in outcomes, and we're 2x times the cost of anyone else per capita in the world. That's not sustainable. As a matter of fact, any other business like that would have to declare bankruptcy. The reason it's not become bankrupt is because of legislatures that are creating these capabilities to maintain things like, nonprofit status and things of that nature that give, not level playing fields of competition and so forth. Now, to better answer your question specifically, yes, I have tremendous respect for what hospitals do. I love the fact that they provide the level of care that they do. The physicians in them are fantastic. Respect all of those things, but there's no question that we're not doing what we need to for the socioeconomic capability that needs to be done on behalf of everyone in this country. A whole lot more needs to be done, but until the hospitals and the insurance companies are really all willing together to do this, I don't see that this logjam is going to be broken. It may wind up being the federal government that essentially creates the answer.
Right. I mean, obviously, it's a hugely complicated problem, and just to be fair to hospitals, they will point out, if you talk to hospitals, that they do a lot of good things for the community, charity care. They would say they're operating within a system.
Yes.
That exists, rules that have been set up, right?
I would say to that, kudos to the hospitals for the innovative care that they provide and, things of that nature. I don't think there's any question about that. And, when I go with hives or something like that, or any patient or what have you, they'll take care of me and anyone else. And we all greatly appreciate that. That's no question. They're there for us.
Right. And, there's other players too, but I hear your point as well. I just wanted to switch a little bit and, talk about sort of something that you all said this month in October of 2024. You said that you had sold a stake of the business side of your operation, the billing, the HR operations, technology, to a private equity firm, TPG, which is based in San Francisco. And I know the Ledger and North Carolina Health News wrote about that, covered that pretty comprehensively. Sometimes people have concerns about the involvement of private equity in businesses. What is it, just straight from the horse's mouth, what is it you want to say to patients, as far as the effect of that?
I would tell patients, I'd look any person in the eye and tell them straight out, it will not affect how we take care of you as a patient, the time we spend, and our desire to make it a great experience for you with our organization. Your health outcome is the most important, and that's number one priority for the physicians and will always be, and that will never change.
When companies take, capital from the outside, it can help you grow. Is this something that's will it make you more efficient? Will it help you grow? What are the growth plans for Tryon?
So I'll answer it like this because I've had probably a dozen patients come and ask me, some online and some, face-to-face. But we had basically two different companies. One is Tryon Medical Partners, which is the physicians only. And the other was Tryon Management Group. And Tryon Management Group was the business aspect of running things for the practice. And it also housed where we do shared savings, direct to employer capabilities. It's where HR resides, legal, revenue cycle management, all of these different departments, real estate, buildings, and so on. And what we realized was that in order to supercharge our capability in value-based care and provide that opportunity to improve the care at a lower cost on behalf of the patients, that we need to supercharge this financially. It is incredibly financially and labor intensive. TPG is going to be bringing technology and analytics investment, and the physicians are maintaining their sharehold as well within that portion of the organization. So it's going to be a great partnership that will drive our capabilities to improve, as you mentioned, efficiencies, things like that. But we're also going to be able to hire top-notch talent in the country now and have much better understanding, control of our data, because then that's really the key, so that we can better know where we need to invest our efforts in the future. Yeah,
it's really interesting. You look across industries and just the access to data and then analyzing that data, making data-informed decisions is something that's a lot of people say is really important. Really? So where do you see Tryon Medical 5 years from now, 10 years from now?
Well, as it is right now, fully independent practice, in complete control of the medical aspect of everything that we do on behalf of patients, just as we are now, and hopefully anticipate that we are growing significantly, not for the sake of growth, but because we know that we have something that many other independent practices need. We're going to bring it out to other independent practices and let them kick the tires and find out how it can benefit them. Those that are interested in our value-based medicine platforms and shared savings, we'll do that. Those that are interested in joining us outright, we'll do that. We'd love all those types of interactions. And we anticipate that we'll concentrate here in Charlotte, but we're already out in many other MSAs, regions, cities and so forth, and communities. And I can't really divulge, where those are. We don't want to, divulge the roadmap, but it's contiguous counties, other places in the state and region of the Southeast.
You're saying you're seeing yourselves maybe set up a few more offices, that sort of thing, in some of these adjacent regions?
Well, we would definitely anticipate a growth mode. We want to concentrate on what we do really well here in the Charlotte community and such. And then as we expand into other communities that are asking us to come in and so forth, and that we reach out to them, we've seen that almost an equal amount. That's been exciting. I think that those opportunities are definitely out there.
So one final question, when you're out at healthcare conferences, what sort of trends are people talking about? What is the hot topic?
When I'm at conferences with independent physicians, it's how to stay independent. When I'm at conferences that's a mixture of hospital practices and independence, it's about, how are we going to drive, quality metrics, the most innovative new things in healthcare, things of that nature. And then on the independent side, it's taking those very same things that are in major conferences, but now how do we apply it to our independent groups so that they can maintain, their solvency and continue to strive forward? We think it's critically important that independents remain independent because patients need an alternative. And I think that by being able to coordinate care better and being that quarterback for patients, I think that we'll be able to really bend the curve on the spend while maintaining the same or better quality. I would say that that's the main thing I hear from the independents.
Great. I think that's a good spot to leave it, unless you've got anything else you'd like to add.
There is one thing I would like to say, and that's that what we are trying to do, and I think we're succeeding very well at it now, is better service, better quality at a lower cost, putting the patients first. What a novel concept.
All right. Well, Dr. Owen, thanks for joining me.
Thank you. Take care.
To our listeners, thank you for listening. You can find out more about the Charlotte Ledger at thecharlotteledger.com. This episode of the Charlotte Ledger podcast is produced by Lindsay Banks.
QueenCityPodcastNetwork.com.